Caregivers often feel too intimidated to bring up concerns to a healthcare provider about the care provided to the care recipient. They could also fear retaliation if they're perceived as confrontational, demanding, or complaining. Do not be afraid to ask questions. Advocate for your person's care. If talking directly to the healthcare provider does not address an issue, and if you feel that they have violated any of the patient rights, you can make a complaint. Patients or their caregivers make complaints so corrective actions will be taken to address an issue and to reduce the chance of that issue happening again. Most hospitals have protocols for receiving and handling complaints. Contact the patient's relations department to learn about the process to file a complaint. Complaints can be made directly to a healthcare provider, the College of Physicians and Surgeons of Ontario, or to the Ontario Patient Ombudsman. Sometimes patients may feel a healthcare provider is too slow to respond or appears not to be taking the complaint seriously. In this case, they may, for example, send a complaint to the college or the patient ombudsman, contact the news media, or voice their feelings on social media. Caregivers need consent of the patient or the patient's substitute decision maker to make a complaint and to share the patient's personal or health information in the complaint. The patient also needs to provide consent to the college, the ombudsman, or the care provider if they want their personal and health information shared with the caregiver for the purpose of attempting to resolve the complaint. When it comes to long-term care homes, many caregivers don't make complaints in fear of retaliation against their family member or friend residing in the home. Retaliation and fear of retaliation can be a reality for individuals living in long-term care homes and their caregivers. If retaliation happens, it could take many possible forms ranging from instances that are egregious or highly visible to more subtle actions. In some cases, it can be difficult to know if the actions are the result of being short-staffed, an emergency with another patient, or several requests happening at the same time. Some possible examples of retaliation include call bells not answered or answered slowly, food trays coming late past mealtime, difficulty getting medications when needed, bathroom usage, not providing food and water when requested, general lack of attentiveness, bullying. If you think the actions are deliberate and you are concerned that retaliation is happening, you should speak out about the retaliation you are seeing. Talk to other families for support or attend the family council meetings and bring up issues there. Identify supportive staff members in the building that you feel safe discussing concerns with. Remember that staff fear consequences of complaints too, such as getting fired, losing their license to practice, and lawsuits. When advocating for your care recipient, be constructive and understand it. Communicate that you want to be part of the solution. Caring for someone can be stressful, and collaboration between caregivers and health providers is in the best interest of the care recipient. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.